Hello wonderful people. In this video we're talking about 7 important factors to consider when we're thinking about the course and prognosis of depressive illnesses. So if you or someone you know suffers from a depressive illness, this is a really important video when considering the future of that illness. Before we get started, I just wanted to introduce myself though. My name's Dr. Sil, I'm a junior doctor and I work in Sydney, Australia. But in my free time I love making YouTube videos about mental health and wellness. If that's something that interests you, you can consider subscribing. Now the first point I want to talk about in this video is that depression can start at any age. But if it starts when you're older, say over the age of 60, then the depression tends to be a more milder but chronic form of the disease. It also tends to be an exogenous type of disease, so triggered by an external event like the passing of a family member. Now it's normal to feel sad, it's normal to mourn if someone you love has died, but when it gets more than 2 weeks post the event and it's causing functional impact in your life, it could be transitioning into something that's atypical, that's not normal, that's abnormal, a depressive illness. The second point I want to talk about is the length of episodes. Now, for depressive episodes, they can last for as little as 2 weeks. But for more severe cases, they can last up to a year or more. And the average of severe depressive cases lasts for 6 months, okay? That's the average length of a depressive episode in severe depression. And 25% of people with a severe depressive illness, their episodes will last for a year. Okay, so it can be very, very long. But there's some good news regarding the impact of medications, and I'll talk about that at the end of the video. The third point I want to talk about is the risk of recurrence of a depressive episode if you've already had a depressive episode. So if you've had a depressive episode, the risk of recurrence at 10 years is about 1 in 3. So 1 in 3 people who have had a depressive illness will have a second one within 10 years. And for 20 years, it's just over 1 in 2. So 60% of people who have had a depressive illness, a depressive episode in their life, will have a second one within 20 years of that first one. So to simplify it all, it's more likely than not that in your life you will have more than one depressive episode if you've had a depressive episode before. The problem with this is that there's such a wide variability with people's course of the illness that it's impossible to predict when you'll have another depressive episode. Unless you have something like seasonal affective disorder, which has a kind of cyclical nature to it, a yearly thing. Most depressive illnesses, it's impossible to predict when you'll have your next episode. Now the 5th and 6th points that I want to talk about in this video are actually the good news. Now the 5th point is that recurrent episodes of depression tend to be much shorter than the initial episode. So the range for recurrent episodes is usually between 4 and 16 weeks. Now, the 7th point is the really good news, is that there are effective treatments out there, and for moderate to severe depression, a mix of antidepressants such as SSRIs, things like fluoxetine, or SNRIs, things like venlafaxine, mixed with psychotherapies, things like cognitive behavioral therapy. When you merge them together, all the things I've just told you about, the recurrence rates, the length of the episodes, the severity of the episodes, all of those things are shorter and more mild and less severe if you use that appropriate therapy, the mix of those two things. And if you mix those two things, plus you have a good social network, plus you're healthy physically, then the prognosis is much more improved. So I'm just gonna finish the video by talking about some of the prognostic factors that are protective and some that suggest that you might have a poorer prognosis. So the good prognostic factors is if you have an early age of onset, that is an endogenous depression, so it's not triggered by anything in particular, it just starts without a kind of known trigger, and the symptoms have an acute onset. Inversely, the poor prognostic factors that suggest that you'll have the course will be a bit longer and maybe more severe, a late age of onset, longer prodrome of symptoms, so those kind of subclinical low-grade symptoms before the episode, a longer prodrome. Comorbidities such as drug and alcohol or other mental illnesses or even physical health illnesses, and poor social supports. But, if you can address these things, like address the drug and alcohol problems and improve social supports by joining groups, and then you add that psychotherapy and medicines, and you put them all together, you can have really good outcomes. Okay, guys? So there is hope. That's great. So I'm going to leave you with that, okay? There is hope. I hope this video was helpful in, teaching you a little bit about the course and prognosis of depressive illness. If you found it helpful, you can support my channel by just leaving the video a like or sharing it with someone who you think would benefit from watching it. Other than that, I wish you all an absolutely wonderful day, and I'll see you all in the next video. All right, bye for now.